Next question, question number 64. 9-year-old girl has a nursing diagnosis of altered body image related to change in appearance secondary to varicella infection. The child's body is covered with a rash and many large weeping pustules. So nurse provide counseling to the mother who is concerned that the child will develop scarring. Which intervention is most appropriate? So what's the meaning of the question? 9-year-old girl, and she is literally conscious about her body image, and she was infected with a varicella infection. It is chickenpox, and currently the patient has a rash, weeping pustule, and the mother is also literally concerned regarding the look and scar. And scar is very common in case of chickenpox infection. So how do we manage? Go through the option and select the answer. See, you have to remove the wrong answer, which is not suitable with varicella infection. Then you can select the correct answer.
Option A can be removed, ma'am.
Okay, keep the skin out of the direct sunlight. Yes, very good. Yes, then.
C also remove, ma'am. Wash posture with soap and keep dry.
Option C can be removed. Yes, ma'am.
With soap. Yeah, very good, very good. So A and C can be removed. Yes, then.
B and D. Answer B, ma'am. Apply calamine lotion to skin every 2 hours.
See, when you get the options, you at last you will get 2 options. Fine. So when you get 2 options as correct, you have to read each and every option, each and every word of the option, and then ask the option whether this particular option will give any positive thing, or is this option is right or true statement. So B says, apply calamine lotion to skin every second hourly. And D says, soak in a colloid oatmeal bath 3 times daily. What is the meaning of D? What is the meaning of D? Yes. What is oatmeal bath? See, for this particular patient, chickenpox infected patient, they won't be able to use soap and they won't be able to use a scrubber. Fine, because in the skin there are many weeping pustule. Weeping pustule is like a burning pustules. Fine. So in this particular situation, instead of soap, what we can use is colloid oatmeal bath. That means you have to take oats and then soak the oat, and then if you want you can just boil it, or take a boiled water and just put oats in that and wait for some time. When it get completely soaked, you can just take that oats and then rub it on the skin. Clear? That will help to remove all crusty lesions. Okay, and it will be like acting as a safety. Or when you are using your nails, or when you are using your hands to remove the scales, it forms like lesions. Okay, so you can use any kind of natural thing in order to remove the scar. See, calamine lotion will help to soothe the skin. Okay, calamine lotion is normally necessary for this weeping pustule. It will give a soothing effect, so the itching can be prevented, or the pain can be controlled, even the dryness can be almost controlled. Okay, so calamine lotion will help to soothe the skin, as well as it is helping to reduce the discomfort of the patient. Okay, but it will not have any direct impact on scars. So in order to maintain a proper skin and scar-free skin, they can use oatmeal bath. Okay, so just apply colloid oatmeal bath, and that should be every 3 times a day. And again, in the second option, there is another statement which is used. It is like apply calamine lotion to the skin every second hourly. See, it's wrong. Every second hourly, we won't be able to apply calamine lotions. Okay, so that is the reason why I have not selected answer B and why I have selected D. മനസ്സിലായോ? ഈ ചെറുപയർ പൊടിയൊക്കെ വെച്ചിട്ട് നമ്മൾ ദേഹം കഴുകൂലേ? കേട്ടിട്ടുണ്ടോ അങ്ങനെ? ചെറുപയർ പൊടി, കടലമാവ്, ഇങ്ങനെയുള്ള സാധനങ്ങളൊക്കെ വെച്ചിട്ട് കുഞ്ഞുങ്ങൾക്ക് സ്കിൻ ഇൻഫെക്ഷൻസ് ഒക്കെ ഉണ്ടെങ്കിൽ നോർമലി നമ്മൾ യൂസ് ചെയ്യാറുണ്ട്. ആ സെയിം മീനിങ് ആണ് ഇവിടെ ഉദ്ദേശിക്കുന്നത്. സോ ഇൻസ്റ്റെഡ് ഓഫ് ചെറുപയർ പൊടി, ഓട്ട്മീൽ ബാത്ത്. ഓക്കെ, എനി ഡൗട്ട്സ്? യെസ്, പൂർണിമ, cleared with the answer?
Yes, ma'am.
Okay. Next question. The nurse is assessing a client with a possible Cushing syndrome. In a client with a Cushing syndrome, the nurse expects to find those who have not attended Cushing syndrome class, which is there in endocrinal system. After maternity will be starting endocrinal discussion. So here the client is admitted with Cushing syndrome. Cushing syndrome is a situation, it comes under endocrinal disorder where glucocorticoid is produced excessively. Those who have not attended the class, still you need to just write down Cushing syndrome, put a hyphen and just write increased glucocorticoid. Increased glucocorticoid causes Cushing syndrome. What is glucocorticoid? It is steroids. Okay, so when steroids are produced excessively in our body, all Cushingoid features will be expected. So what are the signs and symptoms of Cushing syndrome? Just look at the picture. There will be pendulous abdomen. You can just look at the picture. Pendulous abdomen. Look, so the abdomen look like a pendulum. And look at the face. It is moon face. Okay, and on the back there will be buffalo hump. Same way, please look at this abdomen. There are stretch mark. So stretch mark over the striae or stretch mark over the abdomen. Okay, and to get bruising of skin or skin damage, like easily the skin get damaged, or there will be chances to get a bruising. Fine. And when you look at the extremities, that means hand and leg, extremities are thin, and the central portion of the body, is the chest and waist portion. So the central tummy also. So the central portion of body will be obese, but the extremities are thin. Okay. So in Cushing syndrome, what we expect? Extremities are always thin, but the central portion of the patient's body will be thick or obese. So you can write down striae on the abdomen, moon face, pendulous abdomen, and central obesity, and buffalo hump. One more thing, hirsutism. What is hirsutism? Excessive facial hairing or excessive formation of facial hairs in females mainly. So please select the answer. Cushing syndrome is because of increased production of steroids. So please select the answer.
Answer D.
Answer D, ma'am.
Answer D, deposit of adipose tissues in the trunk and dorsocervical area. Very good. It is considered as buffalo hump. See, normally when you get confused with the A, weight gain in arms and legs. See, please remember, in arms and leg, there won't be weight gain. Weight gain is expected in the central body portion, that is on the tummy and on the waist and hip area. Okay. So yes, next question. Question number 66. Which vitamin deficiency is most likely to be a long-term consequences of full thickness burn injury? So the situation of the question is, patient is admitted with a full thickness burn injury. So the skin completely got damaged. Even the depth of the skin got damaged. Okay. So what vitamin deficiency is expected as a result of long-term consequences? It is not something related with the immediate effect. What is the long-term consequences associated with a full thickness burn injury where skin has completely got damaged? So when skin got damaged, what are the complications that is expected? Yes.
Vitamin D deficiency, ma'am.
Why? Why vitamin D
Because of
deficiency?
skin will be burn. That's why, because skin will be absorb vitamin D. Production
Very
will
good.
be.
So in the skin, we have melanin cells or melanocytes. Melanocytes are necessary to absorb vitamin D from where? From
Sun,
where?
ma'am.
From the
Sun.
sun.
Sunlight.
Okay, very good. So the long-term impact or long-term consequences is vitamin D deficiency. What is that called as vitamin D deficiency? Vitamin D deficiency. See, vitamin D is a vitamin which has various functions. One of the most important function is calcium and phosphorus metabolism. So vitamin D is helping for calcium and phosphorus metabolism. Okay. So vitamin D deficiency causes damage to the bone. Fine. So it causes rickets. Vitamin D deficiency causes rickets. Next question. Question number 67. Sildenafil or Viagra is prescribed to treat a client with an erectile dysfunction. A nurse reviews the client's medical record and would question the prescription if which of the following is noted in the client's history. So what is the problem of the patient is erectile dysfunction, and for that Viagra is advised. And the question says one of the following problem is considered as like a problematic thing when you administer the same kind of medication. Neuralgia, insomnia, use of nitroglycerin, use of multivitamin. So one of the following situation, when you observe, you need to question the prescription. That means one of the situation where you cannot administer the medications. See, normally this medicine is used to treat erectile dysfunction. So the contraction will happen as a result of this medicine. So try to remove the wrong answer and select. So there is no relation between insomnia and this problem. So I think you can remove B.
Use of multivitamins also.
Yeah, you can remove, very good, use of multivitamin. Yes, you can remove B and D. And from neuralgia and use of nitroglycerins, what will be the expected thing?
Use of nitroglycerin, ma'am.
Use of nitroglycerin. Why?
Because of it is heart related.
Exactly. So yes, nitroglycerin is like a vasodilator or a constrictor.
Vasodilator. Yes, ma'am.
It's a vasodilator. Okay, so it causes hypertension or hypertension. Yes.
Hypertension, ma'am.
Think and answer. Vasodilator. Since it is a vasodilator,
Vasodilator is hypertension.
Vasodilator is considered as the choice of treatment for hypertension. My question is, what is the side effect of nitroglycerin? Vasodilator ആകുമ്പോഴേ എന്ത് ഇമ്പാക്റ്റ് ഉണ്ടാവുന്നത്? BP will reduce or increase?
BP will increase, ma'am. Reduce, sorry. NTG.
Nitroglycerin will reduce the BP.
It reduces the BP, yeah. It is a
Yes,
vasodilator.
okay. It's since it is vasodilator, it reduces the BP. Very good. And please write down the side effect of Viagra, that is dizziness, headache, flushing. Dizziness, headache, flushing. Nausea and vomiting. And it is not advised in a patient with a chest pain. Medicine is not advised in a patient with a chest pain, angina, and cardiac disorder, renal problem, sickle cell anemia, vision problems. Next point, please write down. Person should not take cannabis or alcohol. When a person who is using this medicine, they are not supposed to use alcohol or marijuana. What is marijuana? It is cannabis, kanjava. Okay. Okay. Next question. So the answer for 67 is C. 68. The physician orders 1 liter of normal saline infusion for 4 hours. How much normal saline should be delivered to a client in 1 hour?
250, ma'am. 250 ml.
Exactly, it is 250. Okay, so it's 1 hour. The 1 liter, that means 1000 ml need to be completed within 4 hours. So 1 hour is 1 hour. The person will get 250. That means 1000 divided by 4. Next question. Yeah, this best diagnostic test to suspect leukemia. What is leukemia? It is blood cancer. So basically, to confirm any kind of blood cancers, the better investigation is biopsy. That is bone marrow aspiration and biopsy. Next question. Yes. The primary nursing goal when caring for a child with a leukemia is, I repeat, what is leukemia? It is excessive proliferation of WBC causes leukemia, or this is a blood cancer. And what happens in leukemia? Excessive amount of WBCs are produced, and all of these WBCs are abnormal, but the production of normal number of WBC will be reduced. Okay, so the answer could be normal. Increased amount of WBC is expected, and all of these are abnormal, and normal number of WBC is less. Okay, so it causes.
Answer is prevent infection.
Exactly, so the answer is prevent
infection.
Okay, okay, fine.